Aloha. Hafa for our friends in Guam, and Talofa for American Samoa. So, hello. Thank you for taking time out of your busy days to be here with us today for our first 2018 Town Hall for VA Pacific Islands Healthcare System. The director has committed that we will have a town hall each and every quarter for this year, and so on. So we'll stay pretty close to the agenda. We'll be here about an hour, and she has a lot of great, interesting news for us as she just returned from Washington, D.C. to meet with the secretary. So without further ado, I bring you our director, Ms. Jennifer S. Gutowski.
Oh, now it works. Aloha, everyone. Aloha. I'm really glad that we have this time today together. As Haywood was saying, I just got back from Washington, D.C., and there's a number of things that I want to share with you, and I want to share with you a little bit about what our journey has been also in the first quarter of fiscal year 18. Many of you may or may not be aware, we actually had a strategic planning retreat with all of our service chiefs. Actually, let me start it back further. It started when we got called to meet with our VISN partners, VISN 21, with Sheila Cullen and some of our lead staff to work on strategic planning for the VISN. And from there, we then brought that information back and shared it with our service chiefs. And then we had one-day sessions with our supervisors. And so today, I'm going to fill you in on what we've been talking about and where we are going into the future. Some of the things that we talked about that I'm going to introduce some concepts is a concept you'll hear us talk about foundational services. So Dr. Shulkin talks about foundational services being kind of the meat and potatoes of what we do. This is our primary care. This is our mental health. This is our bread and butter, the main course, the meat and potatoes of what we do every day. Hopefully that's not me doing that. That's the foundational services. Services such as, I'll give an example of non-foundational, would be something like chiropractic care. Chiropractic care, currently we do not have in-house, and we rely on the community to provide that service. So that's how we classify non-foundational. Okay? So I want to explain that a little bit because you're hearing me talk about foundational services and non-foundational services, and that's what that means. So we spend a lot of time in that initial group with the VISN talking about what are foundational services for VA Pacific Islands healthcare system. And we'll share that work with you on what we came up with. The second thing that we really talked about was doing a market assessment. So this was looking at our market area and understanding why we're different and why we're similar to other markets across the nation. And we looked at our market, VA Pacific Islands. We actually have 11 sub-market areas. And that's all of our clinics that are on the different islands, and as well as the 2 different markets I would consider here on the island. We have the leeward side, and then we have our main facility here at ACC. So we talked about all those things that make us unique. What's unique about VA Pacific Islands? They're saying that there's going to be a contractor that's going to kind of help take a look at our market. But it's important for us to be able to share with them what is unique about VA Pacific Islands. For example, if you look at zip code data, don't assume you can drive from Oahu to Maui, right? It sounds basic, but believe it or not, stories have been shared with me about previous consultants when they've come in and they actually didn't always understand those kind of concepts. So it's important for us to have an understanding of our market dynamics and what makes us unique and what makes us different. So all this information shared, and now I'll come to the point of, I'm going to put a, so now I want to talk a little bit about the Dr. Shulkin's top 5 priorities. And I think it's the next slide. Okay, so this is a little hard to see, but I just want to comment about them because we're aligning what we're working on to these top 5 priorities. And I share that with you so that as you think about what you do every day, think about how that connects to these 5 priorities. One is greater choice for veterans. Now I say greater choice for veterans, but I will say that in the sense that I also really want veterans to choose us. We want veterans to choose VA Pacific Islands over the community, right? But in the event that we're not able to meet their needs, the community is there, right? But let's think about how our budget is based, right? Our budget is based on how we get new uniques in the system, new workload, right? That's how we get paid per patient that we see and the level of complexity of services. So we want veterans to choose us, and we want them to be delighted about their experience. So that's a little bit about greater choice for veterans. So yes, we absolutely want to do a lot of work to coordinate with the community and partner where we can, but we also want to make sure that our veterans choose us. The next is modernize our systems, and Dr. Shulkin here really highlighted the decision for the medical record that we're going to be moving into a Cerner type product similar to DoD. That's a huge decision. That is going to be amazing, and I know Lauren and the team from HIMSS is probably looking forward to when that can happen, but it's a little bit down the road, but it's exciting that that's the transition that we'll be moving to. And I think modernize to us also means it's a great opportunity for us to look at how we're doing our work. I'm a big proponent of system redesign and lean, and you hear a little bit from Jana later about that, but it's really important that we're consistently taking a look at what we can do to improve today's work today. And that's not done for me sitting over in E-Wing. That's done by each and every one of you, knowing how to make it a better workplace for you every day. The next is focusing resources more efficiently. So my number one resource, 80-something% of my budget, is you, employees. And it is so important that we're taking care of you. You're hearing a lot about the all-employee survey, and you'll hear a little bit more from Dr. Carlson. Significant work we are going to do on the all-employee survey. We have heard your voice, and we want to ensure that we're doing what we can to make this the best place to work. Truly. We also want to work on improving timeliness of services. And I'll share a little bit more with you about where we stand on that. Because we want to consistently provide services for when veterans want those services and need those services, and when, from a clinical perspective, you all feel that they need those services. And our number one clinical priority is suicide prevention. Number one. And I can't emphasize it enough that it's a community effort. It is not just all of us here. It's not just Tiara, our suicide prevention coordinator. It's every single one of us, and thinking about how we can be there for a veteran or anyone really at that time of need. Because you never know what's going on behind somebody's life when they go, no, I'm good. Right? Sometimes it's being completely present to see beyond that. And I know you all do that every day to be there for our veterans. So just want to share that's Dr. Shulkin's top 5, and here are some of the strategies that we're working on to align ourselves to that. But I want to share with you my experience this past week when I was in Washington, D.C. This was a chance for us to do an organizational assessment. I was invited, there was all level 3 complexity facilities there in Washington, D.C., meeting directly with the secretary, Dr. Shulkin himself. And this is my first time in my career that I have spent a day and a half fully with the secretary. It wasn't one of those do a quick greeting and out the door. No, he committed his schedule to be with all the facility directors. And I know we were level 2 now, which is wonderful, but I think it was a true gift being invited to this meeting. The insight that I was able to gain from spending time with Dr. Shulkin in terms of what his expectations are is truly going to be a blueprint for us on how we move forward. So to share a little bit about that, so level 3 complexity, so in the VA there's level 1, 1A, 1B, 1C, level 2, and then level 3. We were a level 3 complexity. And some of the concern from people who work in level 3 facilities is, are we going to be around, or are we going to be completely outsourced to the community? And Dr. Shulkin's philosophy is, we want you to do as much as you can to gain as much market share as you can to be the best provider you can for veterans, be the #1 provider for veterans. And by doing that, focus on your foundational services, focus on primary care, focus on mental health, and do that really well so that your veterans choose you as part of that. And so I think that was a real change, because we're truly unique in Hawaii, where folks have open choice to Choice 40, right? So they actually can now choose whoever they would like to see. And I want to share with you, we did a little bit of an organizational assessment activity, and I want to share a little bit with you. And I don't want anyone to walk out of here feeling bad about what I'm going to share, because this, to me, is a gift of what I'm about to share with you. It's an honest assessment of where we are. And we're one team. And I know I've got the right people here on board and on staff. And I know we're going to make some significant changes going forward. So let me share a little bit with you about this organizational assessment and where we are. So one of the indicators we looked at was unique patient growth. And all the facilities did this as an exercise. So I'll share with you what we originally submitted, and then I'll kind of share with you, after dialogue with the secretary and VISN leadership, et cetera, and other facility directors, what we ended up with. And I share that again, not for anyone to feel walking out of here bad, but I want everyone to just know where we are, know where we're going, okay? So unique patient growth, I talked about how important that is, that we want veterans to choose us. Well, unfortunately, from November of this year compared to November of the year before, we're actually down our unique veterans by 7.1%. That means there's a certain number of veterans that are not choosing us. Now, maybe that they're going to the care in the community, choosing their primary care provider on the outside. But I always reflect upon that. Well, again, we want them to choose us. So we really have some opportunity there. Because again, when you think about it, our budget is based on that, in terms of our uniques, and we want to grow our market share. Dr. Shulkin was sharing his philosophy from the private sector. And he said that, he was working there in the private sector, you want to get about 80% market share. VA Pacific Islands right now, we're at about 48% market share in terms of capturing the number of enrolled veterans that are in our catchment area. So there are more veterans out there than we are currently serving. So there's opportunity to reach out for new veterans. Now I'm going to run through these, and then I definitely want to open up to some questions. So the next is patient satisfaction. And if I want to mention a couple things here. So if you're sitting next to somebody from primary care, please high five them, because I want to share a little bit about patient experience. Nice job. Good. I want to share a little bit about our patient experience. So this is from our SAIL report in terms of our indicators. And I'm going to talk about patient experience, which has 3 indicators for us. And one is overall rating of primary care providers. And I want to let you know we are in the first quintile for this, meaning we are doing really good at this. So our patients are rating our primary care providers and their experience really high. In fact, it's almost near the 90th percentile. Our scores is 75.22, and the 90th percentile is at 77.33. So really great work to primary care. So whoop, whoop, high five. Specialty care is also doing really well. Overall rating of specialty care provider, so high five a specialty care provider or specialty care team member. They're above the 50th percentile. So our score is 68.24, and the median is 67.87, and the 90th is 73.26. So really good job there. We also have an area that's primary care mental health stress discussed question, and we are also above the 50th percentile here, where we are scoring 58.89, and the 50th is at 57.53, and the 90th is at 63.43. So when you compare us to other facilities across the nation, we're doing very well in the patient experience area. And so we give ourselves a B in that area because we're really doing well and keep up the great work. So the next area is employee engagement. And this is a little was hard for me to swallow because I think it's so important to hear from all the employees on what we're doing and what to make it better. But I'll be honest with you, we ended up at the end of all the discussion, gave ourselves an F. And I'm going to share with you why. We are probably in the lowest 10% across the nation, if not the last or next to last, for a best place to work. We live in Hawaii. This shouldn't be this way. There's a lot of work that we need to do here, because that shouldn't be the case. Just reading this and knowing where we stand, our score isn't even on the grid. Honestly, our best place to work score, we're at 51.71. The lowest 10th is at 55. And that's why I think it's so important, and I'm looking forward for Dr. Carlson to share with you what we've been doing about the all-employee survey, how we're taking the information, the feedback that you gave us, and doing something about it. Because I want this to be the best place to work. And we need to know all the reasons why it's not. Because we want you to feel good about what you do, and when you get home and you get to the dinner table, we want you excited to talk about your day and the things that you're doing. And I know by looking at the scores, there's incredible engagement to the mission. So I know it's not about, the work you do from that perspective, but there's something else missing. It's that other piece. And we really need to work on that, and we're committed to doing so. But again, I just want to share that's where we are when we compare to facilities across the nation. Staffing vacancies. We rated ourselves a D. Now, I want to say that there's significant movement on this, okay? I'll share a couple things. One is working now myself more closely with human resources. We've done an organizational realignment to realign human resources to report directly to the director. And part of that decision was made upon to ensure that we had the right level of grade structure to recruit the very best candidate to come be our head of our human resources department here. And so I'm personally going to be much more involved. I'm certain everyone's excited, but excited for me to do that. But honestly, it's about getting the right structure in place, the right leaders in place, and really help us move forward, because the staff in HR are working really hard. I'll just give you an example. So when I first came on board, there was oftentimes we had negative numbers, meaning we had more losses than we had gains. Since the beginning of the year, we've had 92 gains and only 12 losses. So that's a net of 80 bodies. That's significant compared to where we were before. Now it's not every position, but that's significant movement and progress. And I appreciate all the work that the HR staff are doing on that, because they are moving things forward and working really hard. This is also fabulous news from DC. Did I just say fabulous news from DC? I did. Fabulous news from DC in the fact that we just got approval for 15 new occupations for direct hire authority. That's going to help us get in folks much quicker. So we're really excited for that. And that information will be coming out so that you all are aware of all those occupations. The next area is our sales score. And when I refer to sale, it's really all of the components that are on this. But I always say, don't focus on the actual numbers from that perspective. It's important to know where we stand, but it's about doing the right thing for the employee and the right thing for the veteran. If we're doing that, all good things will happen. But our sale does comprise of patient experience. It comprises of employee satisfaction. It covers access, which I'll talk about in a minute. And it also talks about our quality. And in our quality right now, our fourth quarter sales scores, unfortunately, did not do very well. In fact, they tanked. It's not because of the quality of care we're delivering, though. It has to do with the way that we're also capturing the data. So we have great people that are already working on this to help us improve that going into next quarter. But again, these are areas that we want to do the very best we can to provide quality care for our veterans and to document it as well, because that's all part of quality care. And then the next area is wait times, and let's see. Oh, what did I put this now? Forgive me. Oh. I must have misplaced it. Okay, so I wanted to share with you where we were today on our wait times. Oh, I got it. Thanks, everyone. This is available on the Access to Care website. And this is available for any of our customers or any of you to see as well. And I want to let you know where we are, what it says. So the VA's goal is to be under 30 days for new patients to be seen. And according to Dr. Shulkin, to be a level, to be the A student is really 11 days. So that gives you a sense of what we're working towards. So let me just share with you where we are today. So for primary care in Guam, for new patients, it's 62 days. For follow-up, it's 20 days. In American Samoa, it's 0 days for primary care and 4 days for follow-up. Hilo, it's 44 days for new patients, 6 for follow-up. Kona, 14 days for new, 3 for follow-up. Lanai doesn't have any specific data because it's a small partnered clinic. Leeward has 100 days for new patients and 8 for follow-up. Kauai is 18 days and 2 for follow-up. Maui is 17 and 2 for follow-up. Molokai and Saipan are also partner clinics, so we don't have specific data on that. And the ambulatory care center is 44 days for new patients and 5 for follow-up. On the mental health side of the house, which is also a foundational service, we have, beginning with Guam, we have 32 days for new patients, 8 for follow-up. American Samoa, we have 4 for new and 2 for follow-up. Hilo, 12 for new, 3 for follow-up. Kona, 5 for new, 3 for follow-up. Leeward, 24 for new, 8 for follow-up. Kauai, 11 for new, 4 for follow-up. Maui, 10 for new, 3 for follow-up. Molokai, 7 for new, 0 for follow-up. And the ACC, 5 for new and 1 for follow-up. I share that because, and I'm not, again, I don't want anyone to walk out of here feeling bad because there are a lot of very hardworking people here. But it also tells me from an organizational perspective, we have some refocusing to do to see what we can do to help support primary care and mental health in those areas that we're not doing really well on access, because we now know our veterans are not choosing us and they're going to other places, and that's not what we want. We want veterans to choose us. When you call your primary care doctor, you don't want your wait for, for a new patient to be greater than a certain amount of time, right? It's just like how we would want. So, I share that with you, again, not to make anyone feel terrible, but just to point out where we are. It's an honest assessment, okay? And just on a personal note, again, I don't want anyone to leave here feeling bad, because I think that this was a gift to go to that meeting, to have that honest conversation about where we are as a facility. And now to know and how to go forward. We've got the blueprint, we've got the game plan. Now we got to focus on those strategies to move those indicators forward. And it's about taking care of you, it's about taking care of the veteran. And, I feel, it's one of those things you feel personal about, because I'm not an F student, I'm an A student, right? So I feel that sense of wanting to do the very best for all of you. And I know the team feels that way as well. We've had some conversations this morning about that, and I need all of you to be part of this, to be part of the solution, to be part of turning that ship, to be part of the underdog, being the winner of the game, those kind of things. I'd love to go back next time to Washington, D.C. and share with them all the amazing things that we have done here based on what we're hearing today. And so I want to thank you for what you do every day, because I know you're working hard. And hopefully this will give us a sense of what areas we really need to focus on as a team in moving forward. So I know we have a lot of other things for for this afternoon, but let me just pause and see if anyone would like to make any comments or any feedback. Okay, if anyone would like the microphone, just let me know. If not, I'll let you digest it until we do the open Q&As, because we do have other parts of the agenda that we want to move through. Yes, sir, let me bring you a microphone.
Just one quick question.
Is that right?
One quick question as far as the priorities up here. I noticed that homelessness is not up there. And I know the last time the Secretary came out, it was Secretary McDonald, that we were done with the homeless program, and we were number one. And now we understand completely suicide prevention, yes. And dealing with the homeless, we deal with a lot of homeless, as Chair explained. Just curious, why aren't we up there?
A couple things. This is definitely not a comprehensive list of everything, but I do think you're an integral role, particularly with suicide prevention. Because truly, if people have a home, that definitely makes a difference in terms of that as well. So not every program may be reflected on this, but don't feel left out, kind of thing from that perspective. So you still have a job, you're good. But you know, I think like I was saying is, you know, there are a lot of connections to this, and this was just a snapshot in terms of some of the, you know, main areas that we're working on to share that with you. But you're definitely a key piece of suicide prevention. The money. So a lot of special emphasis programs are considered with special funding from central office. I've not heard of any upcoming changes right now, although the whole theory about special emphasis or special programs is that you're doing it to build the workload to hopefully bring it in. So one of the key things that you all do is reaching out to those that are homeless. So you also find new uniques, new veterans we've never touched upon before. You know, one of the things that the recent stand down I went to in September up in North Shore was you found a veteran that was 90 years old that had never received VA services. You know, that's incredible. Really is. I mean, that's really heartfelt. So thank you for what you do. So I'm going to pause here and turn over to the rest of the agenda because I want to make sure we have a chance to go through that and leave enough time for Q&As. And then also we'll have a way to hear your Q&As, and what we can't answer today in person, we'll have a way to get back that information to you. So let me turn it back over to Hayward.
Thank you very much, Jennifer. I'd be remiss, I was supposed to start today off with a joke. So actually a senior veteran in the elevator told Jim and I this joke a little bit ago, but it's real quick. So why did the skeleton not cross the road? So why did the skeleton not cross the road? Anybody? Because he didn't have any guts. Anyway, it wasn't supposed to be funny, but so we'll move on with the agenda. As Jennifer promised, we'll bring up Dr. Carlson now, who will share our top 3 targeted areas from our all-employee survey. Dr. Carlson.
Can you hear me? All right. Well, I am delighted to be able to present to you a little bit about the all-employee survey. In October, end of October, Jennifer formed officially the AES Task Force. And these are the members here. We meet weekly. I just want you to know this is a very labor intensive, that's not the word, love intensive. All right, and those are the members. Next slide, please. So what is the AES? I know you know what it is, but I may just give you some new information. I'm going to talk a little bit about expectations timelines, the 2017 AES, the top priority areas that you guys had identified, and something a little bit about the processes. So next slide, please. Did you know? I should have asked this as a question and gave out a gift. When was the first AES survey? 1997. 20 years young. 20 years they have been collecting this data. And now they've certainly refined it. In the last 5 years, they have really been looking to each one of the organizations, each one of the facilities to act on it in a significant way. So it assesses workforce satisfaction and organization climate. No other healthcare organization has an in-depth survey like this, which is really big for us. The AES can broadly inform us, but cannot change. Only additional planning and action can enhance the work group's experience. So the AES gets administered in August of every year for 2 weeks. However, this coming year, 2018, it's going to be administered in June, which is interesting. Okay, next, really quick. So the expectations, and this is what the AES task force, Jennifer formed us and we gave her recommendations and she says, done. So the first thing is that the AES, for the first time, the action planning is starting with Jennifer, the director. She has to make action plans, then the PENTAD has had to make action plans, all of the ACOSs, mid-managers, and first-line supervisors with their work groups. So we do have an exemplar model. Every supervisor, starting from the top, has to do one action plan for themselves to help them enhance their leadership, and the other one with their work group. This top-down action planning process will be finished in March 30th. So if you have not heard from your supervisor by March 30th, I should say the 15th, you should say, hey, I want to know about our data. I want to know what we're doing. I want to know what everyone is doing in order to make this a better place for us all. So, so by that time, you should have received your questions, your snapshot, and the formatted data, the actual data. Next. So I just want you to know that what you took in 2017 was essentially the same survey that you took in 2016. There was one major difference on 2017. I'm going to just talk about that really quick. And that question probably was a game changer. Each person was asked to select 3 areas that you wanted to work on. 3 areas that you wanted to work on with your work group. So that's what's really great. So I'm going to now talk about the concepts and questions. If you could just pull that up. I sent that. The snapshot and the AES formatted. Yeah, I sent that to you. Yeah. That will just take a second. All right, so how many questions, this is another text. How many questions do you respond to or can respond to on these surveys? 71 questions. Did you know there were that many? And this year we had one additional, and it's being pulled up right now. I could dance. I need a little music, but it's coming. Hey,
There's a joke.
That's a joke.
Yes, it was the concepts and questions, the data, the Excel. Okay, so these are the concepts and questions, and I'm just going to ask you to go through it slowly. You're not going to, but every one of you should get this handout, so you know the questions that are being asked. So when you look at the data, you can look at the question, because sometimes just that little concept on the left-hand corner, on the left-hand side doesn't make any sense. We have 71, 4 of them are reverse scored just to help us with our brain. But that 2017 there is the new item. There were 10 items that you had to choose 3 of these as to what you wanted to work on. And so those are the 10 areas. If you could just lower that. And then pull up the snapshot, which was just lower that. Just the snapshot. Yeah. Where did it go? There it is, up, right there. Huh. All right. Well, the snapshot, which you will receive too, we have to be flexible here, right? It's going to look just like this. All right, you see the little star. And on the top of the snapshot, it actually tells you how many people had responded. And this is for all VA picks. So we had 715 respondents, which is pretty good. That's like a 70% response rate. That's amazing. And each one of your work groups, you're going to have a separate work group data as well. So the 3 top priorities that all of VAPICs want to work on, we should have a drum roll, but we're just going to go forward. And it's like nothing unexpected. First one is growth, with 39% selected. Second one was workload with 35% selected. And the third is communication. Now, to understand what those 3 areas are, you have to go back to the questions and read what the actual questions was so that you could see exactly what that meant. So those were the 3 priorities. Oh, thank you. And it's in that little blue on the top, and you really can't see it. So it's, as I mentioned, growth, workload, and communication. All right, so now the actual data, which you will receive for your work group, but we're doing all of VAPICs. That was the Excel, I think. Yeah. Open that up as big as you can. No, we don't want that one. That one we're going to close. It should be. No more questions. Yes, we got it. Okay, so now you're going to see what the raw data is in just a minute. Whenever you look at your work group raw data, you should always look at the first 4 columns because that is satisfactory on up, from excellent to... Oh, you have to close that one out because Excel won't let you. You have to close that one out. Is it? I promise you, close that one when you can. It opens up quicker. All right. And then, there we go. So this is all of VAPICs. And just to, we're just doing this to show you. If you could, can you make that bigger? Stella, you're wonderful. I'm sorry. It's hard to be there and working on this. So if you go down, you can see the different areas. And that column where it's green, that's the 2016 scores. That's telling us in those areas that we're actually doing better this year than last year. All right, so if you see that green and you see some yellows, or actually it was supposed to be orange, but it looks yellow up there now. Those are the areas that we're doing slightly less. Anything with an arrow shows us what we've done significantly more. For instance, we did more data sharing, and data use certainly was significant. For our best places to work, as you know, we're 51.72, and we did go up. It's green. We were 51.34. So we are, what that green is telling you is that we're headed in the right direction, and we're trending. In 77% of the items, we're trending higher. So that is truly, we're headed in the right direction. So let's see what happens for next year. Just to let you know, I'm sure my time is done. We did meet this morning and we talked about your comments. Your comments were carefully reviewed and also formatted in a way to really capture what it is that you were saying. And one of the things that we noticed, there were several things that we're going to work on. One of the things we noticed is that customer service, internal customer service, to really care for each other, to answer each other when we connect or we call each other, was such an important thing that people want to work on, as well as other things. So in terms of those three major ones that you did identify on the all-employee survey, Jennifer put together a facility-wide action planning task force. And this AES task force is dealing with those three major areas, and it's made up of frontline staff. So just know that we have, for the first time, frontline staff making recommendations directly to the director, who said nothing is off the table. So this is exciting. We're really headed in a wonderful way. All of your supervisors will have training, and they're continually being offered training to help with work and working with the work groups to certainly make this the best place to work.
Thank you very much, Dr. Carlson.
So if there are frontline staff that are still interested in being a part of the that task force to work on the three areas for the facility, Jamori Texura is one of the leads, and I think I saw Wilford Lee. Is he back there? They're both the leads for that group, so if you're interested, please get in touch with them, because it is very true. There is nothing off the table, and we want this to be the best place to work. So thank you, Dr. Carlson, for all your hard work. Appreciate it. Thank you.
Thank you. So Jana, if you're here, please come up. Jana will spend a few minutes talking about our huddle boards and our board actions, please.
Yes. Yeah. Jana, I'm just going to lead off for a moment, because I want to talk a little bit about why we're making this decision to change over our morning report structure. So some of you may or may not be aware that at 8 o'clock every morning, a number of us sit around a conference room or sit around the phone. We talk about the inpatient transfers that have happened in the past 24 hours and a few other operational issues. But yet there are things that are happening in the organization that aren't necessarily making their way up that's really important, and you all need to be supported. So in order to improve transparency, in order to improve accountability, we're implementing what we're calling daily management, and I'm sure Jan will go into this a little bit more. But it's about huddling at the frontline level, at every level in the organization, to ensure that we have all the resources for you all every day. Okay, now, so that way, when we know that by the time that morning report actually officially, or the huddle actually reaches me, and we're huddling with the front office, with the front office staff, I know that everyone's already had a chance to talk about what's needed from a resource perspective throughout the whole organization. So I'm really excited about this. I think it is a great initiative. A lot of organizations have moved to this as a way to, like I said, increase transparency and accountability. And without further ado, I'll turn over to Jana.
Good afternoon, everybody. So as Jennifer said, and I've heard a lot of themes in this town hall, it's about focusing on the staff, because you guys are the ones that the veteran sees, and they are our voice of our customers. So it's really important that we take really good care of the staff, but we need to hear from you. And in our past, the way we used to do morning report is, like she mentioned, it would come up at 8 o'clock. But by that time, what we're reporting is what had happened yesterday, and then the staff, the day before, had to deal with everything themselves. And then we just got reported. So now it's going to change, where we want to hear from the front line staff. So what I want to talk to you about is daily management system. And it is a lean management system type of thinking. There's various benefits to this. It supports the frontline staff, and I'm going to show you how it's done. It identifies the needed resources. It will create a basis for continuous process improvement. It ensures transparency and promotes two-way communication up and down the line, from the frontline staff to leadership and back down. It breaks issue resolutions down to tiny bite-sized pieces so we can start dealing with them. It keeps tasks very visible so that we can check and support. So part of these DMS huddle boards uses visual management. That's why we need boards, so we can see quickly what's going on. It helps remove obstacles and waste that we face every day. So the biggest question is what is getting in the way of doing the work today? And that is what leadership needs to do, to remove those barriers so you guys can take care of the veterans. And that's why we're implementing these DMS huddle boards. So the format of these DMS huddle boards is broken down into what we call MES. And each letter has a different meaning. So M would stand for your methods, E is your equipment, S is your supplies, and S is staffing. And so we're going to have your board set up this way. Some of you have already started these boards and have experienced it. Okay, can we turn to the next one, please? Okay, so to identify the showstoppers, those things that are preventing you from getting your work done, we work backwards. So in your huddle, in your front line, what you would be discussing is your staffing issues. Do you have enough staff to do your work? If somebody is able to cross cover or to jump in to do your work, then you're green, okay? The next would be supplies. Do you have enough supplies to get your work done? If there's issues with that, it would be red, and then comments would be written. Next would be equipment. What's the issues with the equipment? And then M is finally the last one, methods. If you're not able to find a workaround to deal with these issues. So as you can see, it's really easy to see for leadership when they walk around where you're having issues because it will pop up as red, okay? And we want to remove those showstoppers. Okay, next one. So the other part of the huddle board, the mess is your day-to-day type of things. These quick hits are going to take a little time to deal with. It usually takes 1 or 2 days, maybe your chief having to discuss with another chief to work on it. But it's a communication so you can see that there's an issue, that it was red, someone's taking care of it, and when they expect to finish it. So it improves accountability so people can see who is addressing that issue. They may not be responsible for fixing it, but they are the point of contact. Next slide. These are the very big issues. These issues will take a long time, more than 3 days to fix. These are the ones that usually go up to leadership. Okay? So, and you'll have also on your board some flex space. It's really important to acknowledge people, to celebrate things that have happened. If you were to fix something that was a big issue, celebrate it. You can also use it for announcements. Somebody is out, someone's at conference, there's a survey coming up, those types of things. So there's the ability to flex these boards and tailor it to your needs in your department. Next one. So this is just the supplies for each area. So myself and then John will help you get that together, and some of you have already started it. Next slide. So DMS Huddle Board is a tiered level type of information support system. It starts from the very lowest level and then it goes up. So as you'll see, leadership will not be having any meetings from 7:30 to 9:30. This is the time that they can use to walk around and see the different issues that you guys are faced and try to resolve this. Okay, next slide. So how this works is an area readiness. So it starts off at the very lowest level here. And what research has found is most of the times staff can fix the problems themselves if they had the time to discuss it and talk it through. And that's what we want to do, is to empower the staff to get together, huddle, and fix the issues if they can. If it's not fixable, then it bumps up to the service chiefs and let them huddle and discuss if they can fix the issue. If it's still not able to be fixed, that's when it goes all the way up to executive leadership. And the nice thing about this, you guys, is that at the very top, leadership can see the magnitude of the issues throughout the facility. So maybe primary care is having a certain issue, and then specialty care is having a certain issue, and they can say, wow, this is facility-wide issue. We need to address this. The other thing they can do is, once they get all the issues up to their level, and they can see it because they're listening to you folks at the very lowest level, they'll see all the things that this facility is having to address, and they can start prioritizing those issues for you and tell you which ones are important, because there's only so much that you can handle, but they'll see what is important, and then it will come back down. And if you look at their huddle board, anybody's welcome to join anybody's huddle. You can see that they are following through. So can you go ahead and go to the next slide? So this is the chief of staff, deputy chief of staff huddle board. It's on the front office. And so they're broken down by their mess and their services. But these are all the issues that they're also trying to address. Those issues that had to come up to their level. So what this does is if you're interested, you can see what they are addressing. And if your issue is up there, you can see where they are. So it improves transparency. And once it gets fixed, their service chief is here and they can come back and report it to the staff. It doesn't go away until it gets fixed. So it proves transparency and keeps people accountable. Next slide. This is the Associate Director's DMS Huddle Board. Next one. This is the Nurse Execs Huddle Board. Okay, so this is very difficult to figure out because this is going to be a huge paradigm shift. We are changing the culture. Everybody got to move with us. Okay? So what we had to do was we worked backwards. So in order for our pentad to get all the information that she needs to find out what kind of barriers you guys are facing this morning, she needs to get the information to her by 9:30. All right? For her staff, the pentad to get that information, they need to be huddling at 9 o'clock with their areas. And then, next slide. Then the director has their, we have these other departments that are maybe just one person deep. So she has her own huddle at 9. But then at 8:30, she has certain areas that have departments such as quality, safety, value. So we need to huddle before that to be able to get it to Jackie so she can get it over to Jennifer. So you see how it kind of flows? So it was difficult to figure out, and we're going to have some brainstorming to do when it comes to primary care. Because primary care should be really, I shouldn't just say primary care, but the ones that touch the patient, primary care, specialty care, nursing and all that, they should be discussing what they need to do to take care of the patient. And right now, everybody's in a silo, so we have to get that to work. We also have to figure out how we're going to incorporate the C-Box. Okay, so we're having different discussions about how to make that work, but go ahead, next slide. And then, yeah. So one of my senseis, and I just want to close with this, one of my senseis had said something that resonates to me, is he mentioned, let me see, nothing about me without me. And I thought that was really important. We need to get you guys help. Okay? So I just wanted to mention that because I thought it was really great. Thank you.
Thank you.
So quickly, we'll move into our panel discussion. With the pentad, we'll just take a few minutes. So the format is if you have a question, we're going to do a question and answer period with the pentad. If you have a question, we have a microphone in the stand over here. So please stand up and walk to the mic, ask your question, and then we'll have the pentad members give us an answer.
And not yet, we'll see if that, I want to apologize. So obviously this is our first time doing it this year in terms of the town hall. So we apologize for scrunching in the Q&As, but we will, if you have Q&As, please send it to our points of contact, both Jason or Stella, and we will fill out the answers to those questions. And again, I apologize for the time. We had a lot that we wanted to share with you today, and again, we're going to be doing this on a quarterly basis. So let me open it up. Does anyone have any questions for us? Like I said, if you don't want to ask it in front of a big group, no problem. You can send it in online, and we'll answer it as well.
Good morning. I'm Deborah Lynn. I'm the
You have to
nurse.
speak into the microphone.
Oh, let me see if I can get taller. Good morning. I'm Deborah Lynn. I know. I'm the nurse manager at the Maui CBOC. And I just wanted to ask a question about the AES task force and if the CBOCs are represented on that and who our point of contact might be.
Good question. Judy, who would be our CBOC representative on that if we have somebody? I don't know if anyone's volunteered to be on that. Certainly we accept the members, and then from the group that's working on, oh, we have somebody raising their hand? Bernadette? Great, so we do have a representative from Guam, Stephanie Hicks. And again, we welcome others to be involved with it. I also encourage people that work off shift, if they want to be a part of it, because we do it by phone, so that if people want to call in, we can also include them as part of the committee as well.
Thank you.
Thank you.
Thank Thank you, Jennifer. After this morning's discussion about your meeting with the secretary, I was thinking about the fact that we are very close in meeting criteria for return visits, but not for new patients. But our patient satisfaction is very, very high. And I am concerned that if we shift those numbers around, something's going to happen to patient satisfaction. So what is the goal? I know we would love to be wonderful in every single area, but I think we have to be careful.
Yeah, I hear what you're saying, and I think, we definitely want to hear the voice of the veteran, which is very important. I think also what I shared with you from patient satisfaction was from the rating of the primary care provider and rating of specialty. But if you go ahead and look at our the Access to Care website and look at it from a patient satisfaction standpoint, we also have some improvement. I think it'll be important as we move forward to get groups of veterans together to talk through about what's important to them. So right now there is a big gap between new and follow-up, and we got to find out what's acceptable to patients in terms of waiting, and that I'm sure will vary depending on person, but it'll be important in getting that voice of the veteran as we move forward. We won't lose that. Thanks for raising that. Well, I want to respect everyone's time. So again, I'm going to close this, but again, if you have a question, please submit that to Stella or to Jason, and we will publish a Q&A as a result of today's town hall. Again, I thank you all so much for participating, and I want to thank you for what you do every day in taking care of our veterans and taking care of each other. Mahalo.